actually got my first job. I was fresh out of college and I got a teaching job. And they send you for a routine physical. And the doctor actually just felt my neck and said he felt a bump and that I should follow up with it. And I didn't think much of it. And when they followed up, they found out that I had thyroid cancer. And it was shocking. I was only 23 years old.
At Penn and part of the Abramson Cancer Center, taking care of thyroid cancer involves a multidisciplinary team. And the cornerstone is surgery as the first initial step. And we have an excellent group of surgeons, both in our head and neck surgeons and in our endocrine surgeons, who really are thyroid surgery experts. They do lots and lots of these procedures.
So the field of thyroid surgery has become very, very safe. We're very comfortable with the anatomy, and we are using smaller and smaller incisions as time goes by because we've learned how to make the surgical planes come to us instead of having to open everything up so widely. So when patients come to see me, they get me, my team of endocrinologists, the incredible ultrasound support that we have at Penn, as well as nuclear medicine specialists, and all of the incredible support staff that goes along with treatment at Penn. We like to think about patient-centered care and take care of the individual who happens to have a thyroid problem as opposed to just their thyroid. And this is important because the surgical component has to be done expertly. And that means you want to go to somebody who has a vast experience with thyroid surgery. And we offer that at Penn.
As a nuclear medicine physician, I talk a lot with all the different referring physicians. It can start from before a patient's diagnosed in terms of the scans and whether or not a patient may need a biopsy or not, depending on the scans, and we talk about that, all the way through the surgery and to the treatment. We have all of our referring clinicians basically on our speed dial. We talk before every treatment just to make sure everyone's on the same page and the patient's getting the most appropriate treatment. And that's really become the norm for really excellent cancer care. Our equipment is state-of-the-art in terms of the sensitivity of the scans, so things that would have been really invisible with older equipment we can see better with our scanners. We have various hybrid scanners that allow doing nuclear medicine scans at the same time as CT scans, so instead of seeing just a blob in space, we can really know exactly where it's coming from and to help to tailor a patient's treatment appropriately.
And what we can provide, which is the only place in the tri-state area, this comprehensive evaluation in our thyroid nodule clinic, where we can see the patient is evaluated by the endocrinologist, the radiologist and ultrasound, and have the biopsy performed, and often give the preliminary results so we know that day what the next step is going to be. If the preliminary result is not available that day, you find out 2 days later. We have an amazing nurse who is able to speak much slower than I could ever dream of speaking, and is able to calm all of our patients down, answer their questions in depth, review the procedure with them, and all of this starts before they even come to thyroid nodule clinic. This is done by phone and with letter, and then it's done again in person. The survivorship, the surveillance, is a really big part of our program that involves our phenomenal colleagues in ultrasound, because ultrasound is a cornerstone of doing this, our colleagues in laboratory medicine, as well as our surgeons, if something needs to be done, our radiation oncologists, if we find certain types of spread, and our medical oncologist, who is really leading the world now in our clinical trials, and that's Dr. Marcia Brose.
So what we've actually done that's different at Penn Medicine is we've taken the patients and we've said, starting from beginning to end, from this part of their disease, what do they need? So we were the first to actually develop the sorafenib as a first-line therapy for differentiated thyroid cancer. That trial was so successful, it's actually now available in over 46 countries and 90 sites. And that trial will probably lead to one of the first approvals for differentiated thyroid cancer, as well as there are other options if you have medullary thyroid cancer. So in other words, one patient can come to us and they may have different types of disease, they may be at different stages of the disease, but we have 5 or 6 options available, and it's much more likely that no matter where they are, we'll be able to take care of them. And then what's even more important is when that trial ends and that patient progresses and might need a different option, we already have 4 second-line options available. So a patient can come and have that longitudinal care with one set of doctors and is not running all over the country.
Survivorship is almost getting to worry about the little things again. That I'm so happy when I can sweat the small stuff because that means it's only small stuff going on in my life. But I think survivorship also gave me a lot of clarity. But I'm thankful for that clarity because I feel like most people just walk around and they never get to see, cut through to what really matters. And I get to do that. There's really nothing that I can't do. It hasn't really stopped me in any way.